it isn't a surprise to see that this area of the U.S. economy is growing, and it's under, with healthcare reform, more and more scrutiny to become more efficient and to really have the delivery care system changed. And with all that mandate of healthcare reform comes a real onus and a real burden on the organizations that provide care to step up and create that greater efficiency, while at the same time going through processes that really create a lot of risk for themselves in terms of the different exposure and liability areas we'll talk about shortly. So next, in terms of the growth of small healthcare, this gives you an idea of the number of organizations that are increasing in terms of growth. Look at the diagnostic imaging centers. Home health, significantly, we see quite a burgeoning jump in home health care organizations already. That's going to just continue to increase, with healthcare reform rolling out, because that's where the community-based care closer to the patient delivery model is really going. So this is going to continue to be the case, and this is why this sector of the economy really needs to be focused on in terms of insurance coverages and liability exposure. 87% of all healthcare businesses employ less than 20 employees. This is a staggering statistic for a lot of organizations that we insure that ask where they fall in the continuum. It's fairly surprising for most to see that of the U.S. economy, of the healthcare organizations in the U.S. economy, 87% are very small. And to that extent, if you look at these numbers here, physician offices, which I would include dental practices as well in that bucket, 90% of them have less than 20 employees. So that doesn't mean there isn't risk, and we'll talk about in a few minutes why in the cyber data breach arena, it doesn't matter how small you are, you're just as exposed under the law as the largest health system or hospital out there. But significantly, this is where small healthcare is right now. In terms of growth, we're going to see quite a bit of growth in the small business sector, as you can see from these numbers. These aren't surprising statistics, and these, excuse me, are expected to increase over the next couple of years. The number of providers in the physician and surgeon space versus physician assistants, nurses especially in terms of more direct patient care closer to the patient. These numbers are only going to continue to increase. And as a result, there's going to be more and more dislocation and change happening in the industry under health reform, which is going to mean more heightened risk and more exposure for claims.